I have to begin this message with a heartfelt thanks to all of our members, our 13,000 plus members at the hospitals in SUNY, at Stony Brook, downstate and upstate, and at the hospitals in Buffalo, where we have members who are part of the Academic Medical Center out there. I want to thank all of those healers, those patient care folks who are doing amazing work to save lives, to keep people alive, to give hope to all of us that this pandemic will be stopped and that we will emerge stronger as a society, as a university, as a union through this struggle. This past weekend on Sunday, CNN did an incredible story about the folks, our colleagues at Downstate who are doing this work. We've got the link on the website, and I encourage all of you to watch it so that you can see the work that our fellow members are doing, our colleagues are doing, in very difficult circumstances. You know, there's a certain level of frustration that creeps in when you are trying to make lives better for your members, for each other, and in this situation, it's just very difficult. Nonetheless, what the leadership of UUP decided last week was to marshal resources that we have and purchase surgical gowns for our members, first at Downstate and then at other of the hospitals in SUNY where our members are working to save lives. We are purchasing 100,000 gowns for Downstate to begin with. Those should be arriving in the next 7 to 10 days. The crisis will continue for weeks to come. It is just a small part that your union is doing on behalf of each other. We're in this together, and in trying to utilize every opportunity to help our members. This seemed like, well, to put it bluntly, a no-brainer. We struggled and continued to work to try to get masks as well. You would not believe how difficult that is. The experience is frustrating and painful, and it illustrates how totally unprepared our nation was for this crisis and how badly we have been led as a nation. The good news is gowns are on their way, and they will be at Downstate, and then there will be at Stony Brook and at Upstate, and wherever and whenever they are needed. We pull together in times of difficulty. That's what a union is, and that's what we will be. We are also continuing to fight, not just for the folks at the hospitals, but at the other campuses where individuals are doing extra work, adjuncts in terms of preparing the online courses, professionals in a variety of different offices and settings who are doing extra work, and then clearly at the hospitals where people are doing mandatory overtime and are not getting compensated for it. We're fighting for that overtime pay, and we're also fighting to get hazardous duty pay as well for these colleagues. As you know, the state of New York now has a budget, but it is a budget that does very little for SUNY or for public higher education in general. It's a flat budget. But in these circumstances, a flat budget is better than what could have been the case. We were fearful up until about 2 weeks ago that there would be massive cuts taken to SUNY and to public higher education in general. That did not happen. However, it would be remiss for me to simply say, well, we got a decent budget, we're going on, everything's going to be sunshine and roses. It's not. The economic situation in New York is perilous. In fact, in the entire country. The economy is in free fall. New York State's tax revenues will collapse. We just don't know how far they will fall. We do also know that the governor has been given vast powers to cut the budget going forward. These are perilous times going forward for SUNY. At the present time, those of us at the headquarters of UUP, working with our staff, working with folks that we deal with closely in the legislature, we are analyzing what could be the case going forward and trying our best to ascertain how badly the situation could get for those of us in SUNY. We just don't know. We don't know how much federal assistance will be coming to New York State. Already, hundreds of millions of dollars have been committed in federal relief dollars for higher education in New York. We know money is coming to campuses for those as part of that relief package. But there is talk of further stimulus packages in Washington, again targeting higher education. So there's great uncertainty. We are studying what the financial impacts could be. We are looking at various scenarios. We are also already gearing up for extensive advocacy, lobbying with our federal representatives to increase the amount of money coming into New York to help the state that has been hit the hardest by the coronavirus. It's a question of justice and fairness. This is not the time to talk about cuts to the hospitals, to Medicaid, or to SUNY. Any of the public sectors where we have an opportunity instead to inject money into the economy, that should be the option that is chosen by the state of New York. Where will the money come from? We have said it before over the past year, and we will continue to say that the source of the revenue is in taxing those who are the super rich in our state. The resources are there. We are not talking about massive tax increases, certainly not across the board. We're talking about raising taxes on those who have the ability to pay and reallocating those resources into the institutions across New York State that will generate a multiplier or ripple effect throughout the economy. You look at small towns and the bigger cities in New York, but where our campuses are located, if those campuses are contracted, what will happen is the communities will collapse economically. Instead, money must be injected into these communities through the SUNY institutions that are there, in places like Alfred, in Geneseo, in Brockport, here in Cobleskill, in every community across the state where a difference can be made about our economic future. What's needed is more spending, not less. These are going to be difficult choices that our legislators and our governor will have to make. We are going to exert our voices, and we're going to need every member of UUP, our families, our neighbors in our communities to all advocate on behalf of increased funding, first from the federal government and then from the state, to stave off what could be an economic catastrophe following on a public health catastrophe. Now, I realize that this is a time when we are focused on dealing with the health crisis. We are all working as hard as we can to, again, protect our members, their health and safety, protect our professional rights, protect our communities. But at the same time, we have to plan for what we will be dealing with 4, 6, 7 months down the road. And in doing so, we are beginning to do the advocacy at the federal level. You will be able to go within the next couple days on this website to a link where you can send letters to our congressional delegation. We need both parties to once again come together as they did in the last stimulus plan, only this time focus more intently on the public sector where the money needs to go and can then have a multiplier effect throughout the economy. Those of us outside of the hospitals, we have survived the initial transition to online teaching and so forth. And I can't say enough about how our members have taken on this new role so well. And we should all be proud of that. And we should be recognized for that as well. While we settle into what will be, we hope, a short new normal, we have to talk about what comes next. And that is the economic recovery to match what we hope will be a healthcare and a health recovery for all of us. I thank all of you for the work that you're doing. I thank all of you for your commitment to our state, to our patients, to our students, to our communities. And I hope that each and every one of you stay healthy, stay strong, support each other, and let's together get through this and into a better world that we can all celebrate going forward.